In this room, I'd like you just sort of to indicate with your hand if you or someone in your family that you're aware of has asthma. So most of us in the room, right? You all have breathed hundreds, if not thousands of times just in the few minutes we've already shared together here this morning. And we take it for granted. But when you have severe asthma, you can't take this for granted.
Since age 3 is when they would take me to the emergency room and they would put me in an oxygen tent because back then they didn't have medications.
Coughing, chest tightness, shortness of breath, and then a wheezing sound. Those are the symptoms, and those are just the tip of the iceberg.
For 45 years, I was dealing with asthma and allergies. It was horrible, and it affected every facet of my life.
We should not lose even one more life to asthma. And yet, this year alone, we'll lose close to 3,500, 4,000 lives. That is a travesty.
I didn't think I'd make it to 50, to be honest with you. I figured I would die from, I don't know, not sleeping, or you can't cough and wheeze every single day. Medications weren't working, nothing was working.
Bronchial thermoplasty is an outpatient hospital procedure that you get over 3 treatments. We've been very pleased with the results that we've had in patients that have been treated with bronchial thermoplasty, keeping patients out of the emergency department, getting them off of chronic steroids, and the bottom line for all of this is improving their quality of life.
I haven't been to the emergency room. I haven't, minimal medications. It's almost, I don't even think about asthma anymore. I haven't had one asthma attack in 6 years.
About 80% of patients who are treated have a significant increase in their quality of life assessment score. The clinical outcomes are very robust. 32% decrease in severe exacerbations. That's requiring steroids, going to the hospital. 84% reduction in having to go to the emergency department. That's a huge number.
Probably the most significant patient that I've had her son actually die from asthma. And that actually spurred her to return to see me. She was on maximal medical therapy. There really was not anything else we had to offer her. And this was when bronchial thermoplasty was brand new. She went on to have the procedure done and returned to my practice several months later and feeling great, being able to do what she wanted to do, just a dramatic improvement. When you see almost a 90% reduction in emergency room visits and 50% reduction in hospitalizations, I've never seen that with any treatment.
I run incredibly fast now, and for an old guy, it's fun because I'm in that 50-year-old age group, and I get the young guys cursing at me, go, I hate getting beat by an old guy.
Tony, who's had amazing results, doesn't even consider himself an asthmatic anymore, has come off of a lot of medications, never uses his rescue inhaler, runs marathons, stuff I can't do, and I don't even have asthma.
Since I had BT, it's almost like hitting the lottery. It's better. I feel like a new person. I feel like I can live a regular life like everybody else. I don't have to worry about asthma. I just live my life and it's fun. I can run, I can do exercise, I don't miss work. It's just it's fun, it's a great life.